Life is both simple and complex. Our past links us to our present and future. Some of us know our role and purpose. Most of us are trying to figure it out. Join me. Let's figure it out together.
Welcome back. My name is Fritz. I'm a New York State licensed psychologist, and this is the Ask Dr. Fritz show. During each show, we talk about various topics and different issues impacting our community. During every episode, we try to bring you information and people and practices to help you live your life to the fullest. This episode is no different. During this episode, we'll be talking about anxiety, something that affects all of us. We'll be defining it. We'll be looking at various anxiety disorders. We'll be talking about various treatments that can be offered, how to access them, and we'll even be talking about things that you can do even right now to help manage your anxiety. Now, I'm not going to be doing this conversation just by myself. Seated next to me here is Vlada Levitt.
Hello.
Vlada is a graduate student at Queens College. Mm-hmm. That's correct.
Yes.
And she is studying to be?
I'm a mental health counselor.
A mental health counselor. So you are studying to basically do what I get to do in my office all the time.
Exactly, hopefully.
Okay.
Mm-hmm.
So I'm talking about anxiety here with people, and I want them to really jump into the topic. But before we even get into that, have you been studying anxiety in your program at all? Have they covered that topic in any of your courses?
Well, of course, even with a background of psychology major, anxiety is always a popular subject. Mm-hmm. And recently we just finished up midterms, and anxiety disorders have been a major topic. It
so
affects
you're
a lot of
fresh off the
population.
books. You've been studying various things. Let's talk about the anxiety on a continuum. And when I talk about people who come to me, they're usually in some kind of crisis. Mm-hmm. But all of us experience anxiety. We experience it as somewhat tension. Maybe when we feel it when we have to do public speaking. We may feel it before we have to do a speech or give a eulogy. You know, we experience anxiety all the time for various reasons. What do you think? You know, I'm going to put you on the spot. Sorry, I told you I wasn't going to do that.
Well, thank you.
But what is the utility? What do you think is the utility of anxiety or being able to have that emotion?
Well, it's a natural response to a perceived threat. So mm-hmm. It's useful to avoid a potential dangerous situation. You're going to want anxiety if you are in the streets and you're not going to stop in front of a car.
Right.
You need anxiety to stop yourself.
So we're naturally wired
mm-hmm.
to experience a tension or a certain level of anxiety
mm-hmm.
or something inside of us.
For protection.
Gives us a protection.
Mm-hmm.
I know in basic psychology there is a study called the visual cleft experiment. And in that experiment they have babies crawling across a floor. And when the babies get to the part of the floor where the glass is clear and there's a perception of depth, the babies become agitated and irritable and they don't want to go there. Mm-hmm. And that study, it's an old study, but it was a study that was central in basically showing us that we are pre-wired to experience a certain level of tension or anxiety when we're near natural, dangerous situations.
Mm-hmm. And also agoraphobia is a major phobia. That and fear of heights and fear of certain animals, because they are the perceived dangerous stimulants.
So at its basic levels, our ability to experience tension and experience anxiety is good. The problem is when it becomes, when it's in excess mm-hmm. and it becomes something that impacts our life, mm-hmm. stops us from being able to do certain things, stops us from being able to even go in front of cameras like you're so bravely doing.
Thank you.
And speak. And when it stops us from doing that, it can get to the level of being a disorder.
Mm-hmm.
So let's jump into that. Let's talk about you did a lot of preparation to help me get set for this.
Uh-huh.
Let's talk about the various disorders that exist. Panic disorder.
Mm-hmm.
The quintessential features of panic disorder are periods of 10 to 15 minutes where you feel intense anxiety. Mm-hmm. Your heart is beating out of your chest. Your stomach is squeezing. You feel like you're going to die. You mm-hmm. feel impending doom. Did I miss any?
No, the racing heart and chest pains,
You
breathing
feel like,
difficulty.
yes. And millions of people experience that. One of the findings that I think we did note in the research is that women experience it more often than men. More women have been diagnosed with panic disorder than men. How would we speculate as to why that happens?
Well, maybe they have, honestly, that's a good question. Maybe in the past, well, I'm taking from an evolutionary standpoint.
Yes.
Men had a more active, males had a more active day-to-day life.
Yes.
And perhaps women, they perceive threats differently and they have a lower threshold.
Okay. One of the theories I've been operating from is that men, in terms of kind of expressing their tension, tend to do it outwardly. Men tend to put their fist through the wall, and women tend to internalize pain and internalize and take it and deal with it. And I believe that over time there's a cumulative impact of stress, and what that can do is result in a variety of disorders. But I would think that with panic disorder, when someone comes to me and they've been experiencing panic, what we try to do is really find out about what's been going on in their life, the kind of things that they haven't necessarily been addressing or paying attention to. And often by doing that, they come in week after week after week feeling less and less anxious, and the incidences of the panic will also decrease.
Certainly. Women tend to ruminate more often, so that also.
Ruminate. So in terms of ruminating, women tend to just think about things
Yes.
over and over and over and
Yes.
over again.
Exactly. Think of the past, and then think of what might happen, dread the future. Just slightly higher statistics.
Okay. And it's important to note that what you think, what you're telling yourself, where your mind is going to affect where your emotions go. It's going to affect the functioning of your body. If you are to think of something or rehearse in your mind or ruminate in your mind about things that are stressful, your body and your mind is going to go there. And one of the techniques that I use in my office is something called biofeedback. And with biofeedback, we connect devices to your body to listen to what's going on. We can take your blood pressure, we can measure your heart rate. And what we notice is that depending on what you're thinking and feeling at any given time, your body can go there. And what's interesting about panic is that we're naturally wired for it. We talked before about the babies and how they're naturally wired to feel anxiety when they're getting near heights. We are naturally wired to be able to go into panic if we perceive we're in a situation where we cannot get out, go into a situation where we cannot breathe. Panic from an evolutionary speaking perspective, allows us not to accidentally suffocate while we're sleeping. But the problem with people who are suffering from anxiety and suffering from panic is that those panic attacks are happening when they're not near danger. That's what people tell me all the time, that the panic attack did not happen when they were in a situation where they were extremely stressed. It happened in a situation when they were probably, sitting and relaxing, like we're doing here, sitting and relaxing. And then all of a sudden it comes.
Yeah. And if that tends to happen in a social environment, on a bus or in a crowd, then that could inspire the person to associate that panic with that place or location, and then that could develop into a phobia, or just a dislike of that place, which eventually develops into a phobia because they feel as if that was the onset. The location was an onset, and they're going to have the panic again. They want to avoid the panic, so they want to avoid that place that they associated with the panic attack.
So if you have a panic attack at the corner of 6th and 42nd in Manhattan, then you're going to try to avoid the same location, situation, or stimulus that created the panic attack in the first place. And what I've seen with a lot of people is, actually talked with someone earlier today who had experienced anxiety earlier on in their life, and they were, quote unquote, an anxious kid. And what happened over time as their anxieties grew, they started to develop panic disorders and panic attacks in various situations, and slowly over time, they began to avoid leaving the home. And I mentioned to you before, there may be some of you out there who are watching this program who haven't left the home, and you know that your anxiety started way back when. And what has happened is that the more that you've avoided certain situations within which the anxiety could occur, the more those situations actually become anxiety producing. And you'd asked me something before we started. How do you get used to dealing with stressful and anxious situations? And what did I tell you?
Exposure.
Exposure. So exposure means putting yourself in the situation over and over and over again. You know, getting out here doing this program, I got to do a personal story, is that as a child, I was a very anxious child. If the doorbell rang and someone was there to visit, I would go hide in a closet, I'd go hide underneath the table, and I wouldn't come out until they left. So as a child, I was one of those anxious children. But I was lucky in the sense that at some point I realized, and I wasn't reading the psychology books, but somehow I realized that if you put yourself out there more and more and more, you get used to it. And when you get used to it, you're able to then be able to sustain yourself in those situations. So instead of being the shy kid that went into the closet as I got older and older, when they asked for a volunteer to be the first one to make a presentation, I got out there and I did that.
Wow.
And what happened is that, well, I took control of the situation. I still was nervous. I still feel nervous even when I'm doing something like this.
Which is useful.
Which is useful because it kind of keeps me focused and keeps me going. But now it's in balance. As opposed to if I had let it take over, I would never be able to do the certain things that I do. And similarly with general anxiety, which a lot of people feel, is that giving into it and avoiding things that make you anxious only give power to it. And if you can, in a controlled and in a safe way, expose yourself to situations and work through them and gain some level of success at saying, I did that, then you'll actually be able to do more and more.
And by reinforcing, by not doing that, you're lowering your anxiety at that moment. So you're reinforcing yourself to not have anxiety by avoiding it. So you just have to learn to do the opposite.
So every time you step back from a situation and avoid a situation, yes, it does serve the purpose in that moment of lowering your anxiety. But what happens is that you're actually rewarding an internal system and psychological system to, oh, that was the great way to do it. I fall off the horse, I'm not getting back on again, therefore I don't have that fear. Problem is that now you're forever afraid of being on that proverbial horse.
Exactly. But I feel like we're making it sound a little easier than it is, because people develop these fears over years and years, and to undo it, it takes a lot of effort, a lot of time. You're undoing your thought process. You're undoing your perceived fearful situation, and that's tough, and it's not as...
So when people get into, well, we should go through some of the disorders, and then we'll talk about actual treatment. So we talked about panic disorder.
We mentioned generalized anxiety disorder.
So let's talk about generalized anxiety disorder. Generalized anxiety disorder, as the term implied, is when one is experiencing a general sense of anxiety all the time. Whereas panic attacks can be where you're feeling pretty good, you're feeling pretty relaxed, and then all of a sudden they come out of the blue. With generalized anxiety disorder, you are constantly in a state of dread, in a state of anxiety. And one of the problems with generalized anxiety disorder is that your system, your body, is kind of running in the red all the time, which usually leads to a host of other medical issues, ulcers, headaches, body pains and somatic pains and other illnesses are correlated with generalized anxiety disorder. It's like your body is running in the red or the hot all the time.
It's exhausting. And what's difficult about that is, I imagine, would be you don't know what you're anxious from. You don't know what to avoid, what your body thinks it's avoid, because you're at a constant state of anxiousness. So it must be difficult.
And different than some of the other disorders we'll talk about is with generalized anxiety disorder, it's not like a specific action or a specific situation is causing you anxiety, such as in phobias, you can have specific phobias, or with panic attacks, maybe it's being around people or being in stressful situations that trigger it. With generalized anxiety disorder, you could actually be sitting on the beach and having a good time, and it's still there, and it's still there.
Exactly. And that's, in that way, I feel like they're all difficult to their respect, but I feel like that's a difficult aspect to deal with, because you don't know what you're scared of or what you're...
Yeah. All right, so let's talk about obsessive compulsive disorder.
Surely.
What do you got on obsessive compulsive disorder?
Well, I found it interesting that there's so much on it that it's not considered in the anxiety because it's its own separate thing now in the DSM-5, but it has the same symptoms, so it's still categorized together because it's perceived anxiety, fear, panic.
Right. So with all of these disorders, we're talking about fear and anxiety being the quintessential features, but obviously they're different. With an obsessive compulsive disorder, we have obsessions, which is frequent, recurrent, ruminating thoughts, and compulsions, recurrent behaviors. So the thoughts are recurrent and they're going over and over again, and there's also recurring behaviors. So with people may have thinking about something over and over again, as we mentioned before. And I've said before, when your thoughts are going in a particular direction, if they're going in a stressful direction, then your body and your emotions are going there as well.
Exactly.
With obsessive compulsive disorder, you also have a behavior that's associated with it. Some people, it's about hand washing or checking the locks or making sure that the stove is off or some kind of other ritual behavior that it is performed primarily for the purpose of lowering the anxiety.
Exactly. And it is, you said the hand washing, and that could be debilitating if you can't leave the house because you have to keep checking. Well, the hand washing is a different story. If you have to keep checking if the stove is off, if the locks are closed, and you can't leave the house because as soon as you step a little further,
the anxiety builds up and then you have to go back.
And then it's reduced, so then you're reinforced, and then you
And so in
can't get
many
much done.
instances, actually, when people are chronically late, it may not be because they have time management issues. Something may be going on in their efforts to prepare and leave the home that cause them to be delayed. And with clients who are chronically late, sometimes I explore with them what their leaving procedures are. And that's where I'll discover that they've actually have to do something a certain number of times. And what happens is they do that so many times that they get late. Or there's anxiety about actually leaving home in the first place. They're having trouble choosing outfits, and it's not just because you have so many to choose from, but it's really there's a lot of anxiety that's in the mix, and they're doing those behaviors to reduce anxiety. And if you actually try to quicken their pace, the anxiety may rise.
Yeah, and I thought it was interesting that you mentioned you have all these anxieties could be comorbid with each other.
Comorbid with, can be correlated with each other.
Yes, or that it could lead to depression. So if you have fear of open spaces, you're going to isolate yourself, and that could perhaps induce depression. So it's all related, and it's all something that should be addressed because it's debilitating on different spectrums.
Right. And we'll be sure to touch upon, if we have time later, in terms of, like everyone's familiar with Shakespeare and Hamlet, and the main character would wash their hands constantly over and over again. And you know from the story, the underlying reason is because there's this underlying guilt. So just as a tidbit as to when we get into treatment of anxieties, we're often looking for what are the underlying and emotional causes. We're looking for a trauma. We're looking for what may be going on there that the person has this free-floating anxiety or generalized anxiety or the experience of panic. And
Exactly.
okay. So we've got panic. We've got OCD, we have them. Generalized anxiety disorder, I feel like we're missing one. Oh.
We mentioned phobias briefly.
So let's talk about phobias. Now the thing about phobias is that I think they're the ones we kind of know the most. People who have fear of flying, fear of, let's say, snakes, fear of specific situations, objects, things.
Which is actually interesting because it's the lowest prevalence at 0.8% of, affecting 0.8% of Americans above 18.
Right.
And it's the one that we tend to know the most about.
And that's an interesting thing. So we know the most, well, to a certain extent, there is something easy to understand. With a phobia, okay, I'm afraid of snakes. They make me feel a certain way, and that's why I'm afraid of snakes. Or I'm afraid of heights, that makes sense. And all too often, people's fears of flying or being in heights is even encouraged by what's happening in the world.
Yes.
But 0.8% of the population is experiencing that.
Yeah, well, I feel like it's more
Is that United States? Probably United States.
Yes, the United States, above age 18. But it's more of than a fear. I feel a lot of people have fear of heights or of snakes, but they won't go outside for the snake.
I wonder if that number
even
though
if they live in
includes.
New York,
I
which
wonder if
doesn't
that
make sense.
number includes people's fear of public speaking.
It might. But I
Would that count
don't
as a
think
phobia?
so. I would feel like that would be a social anxiety disorder. Would go under that. So, but it could be because social anxiety disorder is a social phobia. So I think they are separate according to the National Institute of Mental Health. But it's social anxiety disorder itself is 6.8%, which is the highest
Okay. All right.
anxiety disorder. Of
See, we just jumped into the next category. So social anxiety, most people, many times when I've tried to get guests to do programs with me, they seem, I wouldn't have known they had any kind of anxiety except for the fact that they don't want to come on the air with me. And when I say to them, it's just, we're having a conversation, right? So it's just a conversation, but I think for the most part we get anxious because of all the things that are going on in our head when we think of the idea of talking to millions of people and what they think. Don't worry about it. We're just, it's, right?
Yes, it's comfortable.
It's good. And I like, we'll talk about social phobia and social anxiety because I think that was the thing that I had the most of growing up. And one of the ways that I was able to overcome it was by, as often as possible, putting myself in a position where I would have to do the thing that I did want to do or do the thing that I needed to do, whether it was making a case presentation in a professional situation or even before that, just participating and engaging in a social activity. By doing so, I wouldn't say it got easy fast. You said before, it's a lot of work, and I don't ever want to make it sound like working on anxiety and dealing with anxiety is easy. But it does involve a good amount of putting ourselves in a situation where we can approach the thing that is feared. Because by avoiding it, you'll hear me say often, we begin to give power to it. And one time I got to interview, in the moment I forget the name, probably a little bit of anxiety, but this famous author who wrote the book on changing behaviors. And one of the things he said, yes, in our work we need to understand underlying unconscious and dynamic factors, but we also need to get ourselves doing things. And in doing things, we often are able to overcome quite a bit, internal and external work.
Yeah, and I think there's a sort of level of comfort where anxiety is internalized. It's from within. It's how you perceive the world. It's how the environment goes on to you. But at that same respect, you could undo it too. You have that ability. So I feel like that's a sort of empowering idea because you learned it, and then you could therefore unlearn it.
Yes, that's
With
very
effort.
motivating.
Thank you, thank you.
So post-traumatic stress disorder. I want to make sure that we cover that. We're not going to necessarily get to them all, but PTSD, a lot of people are experiencing PTSD. We're in New York City. We're in a city where people were first-person observers of 9/11. Many people lost members of family, friends. I knew people who perished in that experience. And for those of us that watched it on TV, to me that was also a trauma that we experienced. But PTSD, as most people know, it actually became known for veterans returning from war. Post-traumatic stress disorder, diagnosed when people are experiencing traumatic flashbacks and re-experiencing of a traumatic event that occurred at some point in the past. And usually that event is 3-6 months in the past, but the person is still re-experiencing that anxiety like it's happening right now.
They have nightmares or it's vivid.
Night terrors. And it can be triggered by the sound of a car backfiring or an image or a thought or a memory. It can be seemingly random at times, but usually in order to get diagnosed, in order to get diagnosed for PTSD, there needs to be an identified trauma that the person is recovering from. And
I feel like that disorder is especially important now because the veterans that are coming back from the war, currently there's an influx, and also there's, wow, I lost my train of thought.
That's
a little
okay.
bit of anxiety. Useful.
That's okay. You're just going to breathe through it.
I wonder if I could remember now. So yeah, it's more prevalent with military.
Right, we see we in our offices.
I remembered.
I knew it would come back. You breathe through it.
It's because it took the attention.
Here, right on here. Continue.
Took the attention away from you.
Yes.
And it could also be triggered by an experience that someone close to you has has gone through.
Like a secondary
Yeah.
trauma?
Yes. So that's a little harder to understand, but that's also, it's more rare.
Right.
But if you identify closely with someone and they've experienced a trauma, then if you're seeing someone go
through
sick
it. Like we call it a vicarious
Yeah.
trauma.
Yeah.
Many people are also family caregivers,
Yeah.
so they're living with people that have a chronic medical illness. Many people are with family members that may have had a tragedy. Maybe, obviously, we've got death as a trauma, but we can also have lots of other things that people are living with. And we're also exposed to it. We're exposed to it at a time in the world where it is all around us. We can see it on our iPads. We can see it on in our phones. When news breaks in a part of the world, any part of the world, we know about it immediately. And I think what we're going to find over the next few decades is that all of this exposure, we already know this already, but we're going to really see research that talks about the specific effects of being chronically exposed to trauma and tragedy on a regular basis.
And we're empathic creatures, so I feel it's not too far-fetched that we identify with others' suffering.
All right. So I think we have a few minutes left, so let's talk about treatment. There are a variety of treatments offered. I'm a psychologist, Vlada is a therapist. The kind of treatment that we offered are known as the talking cure. People come to us and we do an evaluation, we find out what's going on with them, we get the story of what's going on in their lives, and we give them an opportunity to express themselves.
The best sort of treatment would be cognitive behavioral therapy or behavioral therapy. They're very
We don't usually use best, but okay.
Yes, quotes.
One of the most common treatments.
Yes, exactly. Thank you.
One of the most common treatments, if you go on the NIH website and you look up what they talk about in terms of treatments, they do spend a good amount of time talking about cognitive behavioral treatments. I'm what we call an eclectic when I work with people, so I use a variety of different treatments, from cognitive behavioral to hypnotherapy to relaxation to meditation.
Yes,
So I think we only have enough time to talk a little bit about that kind of treatment. And of course, also one of the other quintessential treatments for anxiety is through medication. And maybe next time when we talk about anxiety, part 2, we'll have a psychiatrist here who will talk about the various different medications that are offered for anxiety. What we can offer is one of the things that I know I use, and Vlada just used here right in front of us, which was she just took a deep breath as the thoughts started to escape her, and then she was able to have it come back. And as we do this, we're able to relax more and more. So I leave you with, take a deep breath, and let it out.